Now, this week we feature the first in a series of films commissioned by Sunday Politics London from young filmmakers at City University about London issues that matter to them. And we start with the difficult issue of eating disorders. An activist in South London is claiming that people with eating disorders are being failed by the NHS. Hope Virgo launched her campaign, #DumpTheScales, after being denied treatment for anorexia from St George's Mental Health Trust in Tooting, all because her weight wasn't deemed low enough. She says that thousands of people each day are turned away from services for the same reason. Sacha Power has this report.
People suffering with eating disorders don't all look the same. This is what relapsing into anorexia looked like for Hope Virgo, now a 29-year-old woman living in southwest London. After being hospitalised with the illness when she was younger, she recognised the anorexic voice coming back into her head following a family bereavement. Hope went to seek help at St George's Mental Health Trust in Tooting, but was told her weight wasn't low enough to access treatment.
I felt a mixture of being completely upset to being like this fake anorexic person to an attention seeker. I felt really suicidal a lot of the time, but also really guilty that I'd actually tried to reach out for support.
After managing her recovery with support from her family, she launched her campaign DumpTheScales, which now has over 72,000 signatures, to call on the government to improve access to treatment for people with eating disorders. But after recently dropping the petition off at number 10, Hope says she was disappointed by the letter she received back from Jackie Doyle-Price, Minister for Mental Health, for not showing enough commitment to tackling the problem.
We got quite a frustrating stock response from Jackie Doyle-Price, not really understanding the seriousness of the issue, focusing quite a lot on her kind of supposed timeframes, but also focusing too much on children and not thinking about adults as well. So after kind of sharing that with a number of MPs, we decided that the next step would be to actually send a joint letter to Jackie Doyle-Price asking her to come back with a proper plan in place.
And in Parliament, the support for Hope's campaign is growing. 56 MPs, 8 of whom are from London, are urging the government to do more for people affected by eating disorders, which Beat, the UK's eating disorder charity and helpline, estimates as around 200,000 people in London and 1.25 million across the country. They say that in some cases, eating disorders can cost lives.
An eating disorder is a serious and complex mental illness that can have extremely serious, often life-threatening consequences. Anorexia has a higher mortality rate than any other psychological illness. Eating disorders are often characterised by people having a preoccupation with food and will often lead to them either undereating or overeating.
The NHS guidelines are clear that eating disorder treatment shouldn't be decided based solely on weight. But an NHS consultant and professor of eating disorders at King's College London believes the lack of resource and training are the reasons why the guidelines aren't always implemented properly.
It's driven, I think, by desperation because lots of services are under-resourced. If you talk to eating disorder clinicians up and down the country, I think they would all wish to give good early care to patients and not turn people away because of some arbitrary weight criterion. I think a lot more could be done already at medical school level to train all doctors to become better at detecting eating disorders and to really understand what they are about.
While Hope continues to campaign for urgent action, she's started work with St George's Mental Health Trust in Tooting, the same trust that turned her away. No one was available for an interview, but in a statement, a spokesperson from St George's said that DumpTheScales is an important campaign and that they look forward to continuing to work alongside Hope to challenge the role of weight in eating disorder diagnosis.
Our thanks to Sacha Power from City University, who made that film for us. And joining me is Hope Virgo. Thank you so much for coming in. Now, listening to that, it's a very difficult subject. How did you feel when you actually looked for help and couldn't get it?
Really completely let down. So I developed anorexia when I was 12 and lived with it for about 4 or 5 years before being hospitalised when I was 17. And then the fact that when I relapsed in 2016, I knew exactly what was happening, and I was so frustrated because when I left children's services, I was adamant I was never going to end up as an inpatient in adult services. And the thing about anorexia is it's such a competitive illness that as soon as you're turned away from services for not being underweight enough, actually that whole part of the competition side of your brain fuels everything, and so then you feel so much worse. And I ended up feeling very unhappy for 4 weeks, pretty much came very close to my life because I was so frustrated and fed up with that relentless anorexic part of my brain constantly telling me what I should be and shouldn't be doing.
And you've started this campaign and you've heard from lots of other people who found themselves in a similar position. What is the reaction of those people when they're faced with the same problem that you were faced with?
Exactly the same. So people either end up losing all of that weight so that they can access services. A lot of people end up ending their lives because they don't know what to do about it. And then there's like this middle ground of people who live functioning very unwell, but not unwell enough to actually access that support. And I come across a lot of people like that who've lived with the illness for pretty much their whole life, but have never ever been able to get any support for it because they haven't met that BMI threshold.
I mean, you know, obviously for people in that situation, they could probably, you know, not imagine why they're not getting that support. But, you know, the NHS has limited resources. And so I suppose, you know, it has to make tough decisions, doesn't it?
No, and it does. And I agree that actually some people do need to have a hospital bed when they're really unwell and some people don't. And for me, actually having community support is so much better. And I spent a year in hospital, and when I left hospital, I was extremely institutionalised. It completely saved my life. But actually, for the first couple of years out of hospital, I was eating my meals at exactly the same times a day, couldn't eat anything that wasn't on the hospital plan. And I'm not saying that actually we shouldn't be admitting people to hospital when we need to, and people who are more severe need to get that support. But it's about getting those people who are on kind of the brink of developing an illness. I know at the Maudsley Hospital, they have a very good way of assessing whether people need support. And as part of that, they do actually support people who are at high risk of developing an eating disorder. And it's things like that that actually, if we do more practices like that, we're going to save the NHS so much money anyway.
Well, I know you've spoken to Jackie. Jackie, listening to that, you know, has the NHS failed people in that situation?
The NHS has been failing people with eating disorders for decades.
But isn't that down to the government's direction? You know, shouldn't the government be forcing them to do more?
If I continue, the NHS has been failing people for decades. We've had significant improvements, but it's still not where we need to be. And what was striking about that film, and the mention was made about more training of people, of GPs and so on, to recognise when people are suffering from eating disorders. That is crucial. GPs do not have as a mandatory part of their training in mental health. And clearly, you know, if we don't take the opportunity for early intervention, we end up with people getting more ill, we're doing more harm to them, and it actually costs the NHS more money. So we need to actually really change that. Get better training, getting better training upstream. We're talking to the Royal Colleges to get better understanding of mental ill health throughout the NHS so that we can do that earlier intervention. But we are talking about something which is transformational, and it requires cultural change and behavioural change throughout the system. We can't do that like that. I'm delighted with Hope's campaign, actually, and I'm very happy to work with her on this, and she and I have discussed this many times. But, you know, we are turning around a juggernaut here because mental health has been a Cinderella for decades.
So, listening to that, you know, do you think it is a case of, you know, just the direction and the training not being right, or is it about funding?
Well, we hear this all the time, don't we? We hear that when the government's very good at producing sort of glossy documents to talk about prevention, early intervention, things we'd all sign up to. Then the reality is the sort of thing that Hope's been talking about, which is that you're either waiting a long time to access treatment, or treatment is effectively rationed, isn't it? That's what's happening here. And people who perhaps could most benefit from it are not receiving it. So it is a fund. I mean,
it's not just that,
Jackie, I hear all the time about more money going to the health service, and when I go back to my constituency...
Let's just talk about people's experiences here. Hope understands her condition more than any clinician.
Let's not talk over each other. Andy, let you finish.
It does make me annoyed, because you hear all these statements of intent from the government, and then I go back to my local NHS and I find out that GP hours are being cut, that urgent care centres are being cut, that palliative care is being cut, and tens of millions of pounds every year of savings are being made. That's the reality, Jackie.
But you're excusing something here. Hope has just explained that when she went to seek help, she understood her condition, she knew she was getting ill, and nobody listened. That's really the issue here. here. We are not allowing for patients to be empowered to look after their own care. We have clinicians who are not properly engaging with their patients and responding to that. That's what we need to change.
And I do agree, no, I do agree with that. I think,
think,
sorry, but I think the funding is an issue, and the funding's always going to be an issue when it comes to the NHS. And I'm not asking for more money, and I'm not asking for more funding to go into eating disorders. That would obviously be amazing, but that's not going to happen. What we're asking for with the campaign is for there to be clear comms rolled out across the NHS so that everyone has a proper understanding of eating disorders. And in the long term, it is all about the GP training and building that awareness. But in the short term, it's just about trying to enforce these guidelines that are already in place so that people do not get turned away for the wrong reasons. And I think, yes, funding comes into it, but it's only a small part of it at the moment, if that makes sense.
But I think
and do you think the government's, though, doing enough?
No, not exactly. So I think what's brilliant is that we have a 10-year plan for mental health services, and that's fantastic. But I think we need some short, kind of sharp, quick action around eating disorders to look at implementing
Sadly,
things.
that's where we're going to have to leave it. That's all we have time for. My thanks to Hope Virgo, and also, of course, to our MPs, Jackie and Andy. And thank you for watching. And I do hope you can join us next week. Goodbye.